Thoracic Outlet Syndrome. Due to poor posture or injury on your brachial plexus area, you're gonna have some tingling sensation all the way to your hands, fingers, and weakness, numbness, and coldness all the way usually to your thumb area. Welcome back to my channel, Annie Pilates Physical Therapist. This video is requested by one of my viewers regarding thoracic outlet syndrome with pinching pain on your nerves, arteries, and veins. And I will show you some 3 simple stretching, 3 special tests, as well as 3 simple strength training program to improve your posture, to open up your chest area, and to relieve the symptoms that you're having. So get your mat ready and a bolster or a rolled towel to join me. Let's discuss first the anatomy for the thoracic outlet syndrome. So the thoracic outlet syndrome is a pinching sensation that happens on the outlet coming from your cervical area, usually the lower side area, all the way down underneath your clavicle, going to the first rib, and there's brachial plexus, which is a combination of nerves, arteries, and veins that comes out, branching out, that gives to the radial, ulnar, and median nerve. So if you have a pinching and poor posture, it causes a limited space, and it causes the symptoms of cold hands. So there's 3 types of pinch. The most common, tingling sensation when the nerve is getting pinched, and we don't want to get to that point. But if you have that situation already, you want to open this area to help, or else you're going to have atrophy and weakness on one side, and regional pain syndrome, also pain on your hand. So you can differentiate if it's coming from your neck, pinch nerve pain, or it's coming from your thoracic outlet syndrome. So I will show you some special tests as well. So for these major nerves and arteries, some people also have an extra rib that they were born with. That extra rib also causes thoracic outlet syndrome, but also with poor posture, as years of having a mild forward head and kyphosis, it causes more pinching as well, where the scalenes, there's the medial and anterior scalenes, originates on your cervical, and it inserts on the first rib. That helps side to side flexion of your neck that gets really tight. And then the posterior scalene also starts on your cervical area but inserts on the second rib, so it's a little bit longer, that helps tilting your neck. So I'll show you some gentle stretching to release all this tension, as well as your pectoralis major minor passes through near the outlet and inserts on your humeral bone on your lesser tubercle to help adduction and chest press activities. And when you're building up a lot of strength on your chest area and you neglect your upper back, it causes more of this rounded shoulder posture. If you want to build so much chest muscle, but with neglecting this upper back, such as your upper traps, rhomboids, latissimus dorsi, and all these muscles on your upper back, and scapular, such as your rotator cuff muscles, that it causes more of this forward posture. I have some videos that I already did for forward head posture that you can check out, the link below, as well as for rotator cuff impingement syndrome. So you can also do that as well to add in this program. So let's first discuss the special tests. Special tests are designed to determine if you have this. So the first test that we're going to do is the Ruse test. Ruse test is when you lift your arm 90 degrees elbow, shoulder 90, and you're going to open and close your hands for 15 times or up to 1 minute. So different theories. Some are could do 1 to 2 minutes until you're having symptoms of the tingling, numbness, coldness, or pain on your hands. So if you're just resting and there's no symptoms, and you start doing this and you started having the symptoms, then you're positive. And then the second test is the Addison test. So you're going to slowly turn your neck away from the injured side where you have the symptoms, because you're trying to tighten up your scalenes. Open your palms out, and then someone has to check your pulse in this area, your radial pulse, and then hold it there. And if you're positive, if after 1 minute you lost your pulse for 1 minute, then you're positive. And then there's also reverse Addison. Then instead of tilting away, you tilt towards it. It's like looking in your armpit, and you're also positive. And the last test is the compression test, cervical compression. This is a special test not only for your thoracic outlet, but to determine if you're having nerve neck impingement syndrome. This is when you're slowly, gently press down on your head and there's tingling sensation going down, then this is not for you. Then you can check out my cervical disc herniation, physical therapy, and Pilates-based treatment plan that you can utilize and do instead. So those are the 3 special tests. So the first stretching that I'm recommending with the bolster is or a rolled towel. That's tighten the towel until it's so firm like a bolster. So you're gonna put it on the mat and you're gonna lie on it. So doing this, you're slowly stretching your pectoralis area, belly button in, engaging your core muscles, and gently open your chest out. And my recommendation is do this for 10 seconds, hold 10 times for beginners, and then slowly, because you're going to feel some tingling sensation if you're positive, so sometimes it's hard to tolerate the 10 seconds hold, to slowly build it up to 30 seconds hold 10 times. And get a timer on your cell phone to remind yourself how long you're doing it. And then after you can tolerate 30 seconds, then you can do 5 minutes up to 2 minutes hold, just opening up so with the pillow also on your head to support. This is all in your thoracic area and your palms out. So if this is your affected area, you dangle it out, and it's great to do it in both arms out. And you take a deep breath, engaging your core muscles. So this is demonstration only, and I'll do a follow along video after this, my next video. So the next one, after stretching your pectoralis muscles, utilizing this is to stretch your neck muscles. So sitting up straight, your palms down or external rotated like this to open your chest more, and then press down on the mat. You can do this as well sitting on a chair, grabbing the chair, the armrests, so you can slowly tilt away, stretching your scalenes. You might feel a lot of tingling sensation right now. As long as you can tolerate it, hold this position for 5 seconds hold for beginners until you can tolerate 10 seconds hold. So my recommendation is only tilt away to the injured side and not to put more pressure. But if you have it in both shoulders, sometimes thoracic outlet syndrome happens in both arms, then do it alternating left and right. So you engage your core muscles by taking a deep breath through your nose, belly button in and blow. So hold it for 5 seconds, hold, 5, 4, 3, 2, 1, and blow. And after that, you can progress by tilting your neck, looking up to address the posterior scalenes that helps tilt your neck. So after doing side and then you tilt up, you feel a lovely stretch on your scalenes. Hold it for 5, 4, 3, 2, 1, and down. Take a deep breath. So side flexion and twist. 5, 4, 3, 2, 1. And my recommendation is to do this 10 times on side. And the third stretching that I'm recommending is to do median nerve glides as well as chest pectoralis. Sitting up, open your fingers and slowly look up. You can also utilize the door for a door stretch, and I'll show you how to do it later. And after doing this, just take a deep breath, open your fingers, looking up, and gently stretch and hold that for 5 seconds hold for beginners, up to 10 seconds hold. So for the door stretch, you find a doorway, place it up, not just in 90-degree, because this is like your roost test earlier. So palms up, and then pretending there's a doorway here, and I'm going to slowly lean forward and feel a lovely stretch on your shoulders, and hold that for 30 seconds hold, up to 10 times, and then back. So you feel a love stretch and opening up in this area. So after stretching these muscles, then you can strengthen it safely. So you're gonna lie on your stomach. So we're gonna do prone, T, Y's, and I's. So as its name is called, it's like letter T with your hands out like a letter T, and you lift up. And hold it for 5 seconds, hold with your breaths, belly button in and down. And do that 10 times. So 5, 4, 3, 2, 1, and blow. So it's like you're flying. You're lifting just your arms for now for beginners, because you feel a lot of difficulty lifting up with chest tightness. And this time, it really targets your rhomboids major and minor. Take a deep breath and blow. Your middle deltoids area as well. Or your posterior deltoids as well for your shoulders and your middle traps. Take a deep breath and lift and hold it for 5, 4, 3, 2, 1. So that's the letter T, prone T. Now it's prone Y. So it looks like letter Y. So it's like diagonally place on your arms, thumbs up, and slowly lift your arms and hold it for 5, 4, 3, 2, 1, and blow. So you're targeting your upper traps, some parts of your middle traps, your posterior deltoid, as well as your levator scap. When you look up, take a deep breath and blow. Inhale through your nose, lift, and 5, 4, 3, 2, 1, and blow. So do that 10 times as well. And the last one is Y. So straight forward, palms down, take a deep breath and lift. Belly button in, so really targets the upper neck area more, and hold that for 5 seconds and blow. Engaging your core muscles. Take a deep breath, belly button in and lift. And 5, 4, 3, 2, 1, and blow. And my recommendation is do that as well 10 times. And then you can end your program with a lovely child pose. It's almost like a door stretch that we did earlier. With your hands out, gently go all the way down. Take a deep breath through your nose, belly button in, and blow. And my recommendation is do this 30 seconds hold, up to 5 reps, to slowly build it up to 2 minutes hold, and blow. Take a deep breath and blow. And that's it. I will do a follow along video with progression for your thoracic outlet syndrome. It takes a lot of dedication and discipline to do this. If you do this every single day, at least twice a day to open up, or if you're in your desk a lot or driving, to take a break, and you can do it in your office area. That was such a lovely Pilates physical therapy treatment plan to help your neck, upper back, chest area, to help your arm to be stronger again and relieve the symptoms of thoracic outlet syndrome. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, Sundays, and sometimes Mondays for Pilates, yoga, physical therapy, health, and wellness. You can also follow me on my social media, my Facebook, Instagram, Reddit, and I also have Patreon account that you can support my channel so I can make better video qualities just like this one. Thanks again for joining me. Have a great and healthier you. Bye.